So the American Heart Association today issuing a new warning on the potential health dangers of too much screen time for children. The group now recommending kids have no more than 2 hours of recreational screen time each day. That's 2 hours, ladies and gentlemen. That's a combination of phones. They're talking about computers, even video games. Joining me now in studio to talk a little bit more about this is Dr. Grant Fowler. He's the academic chair for family medicine at TCU and UNT HSC School of Medicine. Thanks so much for joining us, Dr. Fowler.
My pleasure.
So let's talk a little bit about this and explain a little bit about what can happen here with too much screen time. The association is talking about things like a change in eating habits, sleep problems, even obesity. These things are real.
Sure, and the question is why American Heart for kids? That's when we got to start. We got to get ourselves active at that because that's when the patterns start. The good news, less television time right now. The bad news is we have to do so much screen time. If you look at numbers, television's bad. Television's double bad because they have the food ads. So if a child, and of course, who knows the subliminal part, late at night watching it or something. And one of the things, we got to get the television out of the bedroom. 75% of kids have a television in the bedroom. They see these food ads, it makes them hungry, and the risk of all of this is obesity.
Right, and that's what they're trying to curb because that's a big problem. We know that in this country. We talk about these kinds of things a lot. You know, we've always heard, you know, our parents turn the TV off, get to bed, and that sort of thing. The American Heart Association right now is encouraging, in order to help out with this, encourage more outdoor activities, get the television, get those devices out of the bedroom. What else can parents be doing, though?
Well, we've got to be a good influence. We've got to be a good role model. And we're talking even screen time. I mean, there's so much screen time required for school now. On the average, like 7 hours a day we're doing this. But less than 2 hours we want of recreational. That includes phone screen time. So we got to be a good example. We got to get out with them. We got to do family time where we actually talk. Turn the screens off. Turn the phones off at dinner time. Turn it off during family time or something. But we've got to be a good role model, too, to show them.
I mean, we see this out and about. Maybe a family out to dinner and everyone's looking at their phones, right?
Nobody's talking to each other.
And
that's sad. I mean, that's adding up the screen time right there. So it's all screen time's got to be decreased.
Which brings me to my next question here. In this digital age that we live in right now, how realistic is it to limit this to 2 hours? I mean, can this really be done?
So the last time I was on, there was a comment, there's something called nomophobia, that if you don't have your mobile phone, you get anxious. So it is a reality that we're so addicted to it. I mean, it's almost an addiction to the phone. So you've got to back it down. But yes, like any addiction, you back down gradually. I don't know if we're going to put them through a 12-step program, but you got to say no and back down. We have to. I mean, and that's why they're investing very early for a lifetime habit. So,
all right, Dr. Fowler, thanks so much for joining us and helping us understand this a little bit more.
My pleasure.
We appreciate it. Gilma?
Thank you, Ken.